Again, about 12.7 million children on the African continent have missed out on one or more vaccinations over 3 years. That revelation has been made by a recent Unicef report. The agency says that the disruptions caused by the COVID-19 pandemic could be one of the reasons. Well, for more insights, I'm joined now by Louis Vigneault-Dubois from Unicef Africa Services Unit. Louis, good afternoon. Welcome to today, and thank you very much for your time. I mean, that's a sizable number of kids who are unprotected from opportunistic viral diseases like measles. Just here in our country a few weeks ago, at the beginning of the year, we had a measles outbreak.
Yes, you're right to point that out. And actually, the report mentions that in Africa, out of the 54 African countries, 34 of them this year are seeing outbreaks, disease outbreaks, such as measles, but also polio and cholera. So this is an indication that there is a sizable number of children who have not been vaccinated in the last 3 years. So as you pointed in your introduction, it's 12.7 million children. But we have to mention that out of that, 3/4 of those children have not received one single dose of vaccine. So that's very important.
So they're very exposed and vulnerable. Was the pandemic, the COVID-19 pandemic, the main contributor? And if it was, what were others?
Well, of course, a lot of the healthcare systems across Africa were already seeing weaknesses before the pandemic, whether it's shortages of basic medicines, of vaccines, shortages of medical professionals as well. So the COVID-19 pandemic came on top of that and just exacerbated those weaknesses that we were seeing before. So what we've seen during COVID-19 is, of course, disruption on the healthcare services. A lot of clinics were temporarily closed, and people were asked to stay at home during the hardest part of the lockdowns. But as the systems were kind of resuming, we've seen also a lot of resources dedicated usually for routine and child vaccination being reallocated for COVID vaccines. So personnel resources, financial resources, as well as material resources. So all of that compounded together created that huge gap of children who are today not vaccinated and have absolutely no protection against a range of diseases that can be potentially lethal for those children.
Yeah, I mean, I mentioned measles that we had an outbreak of here. I'm sure it was in other parts of our continent as well. There was also cholera in Mozambique, especially after the cyclone got worse. And in Malawi as well, we've had the re-emergence of the polio virus. This all speaks to urgent measures that are required. What does UNICEF think, Louis, should be done?
Yes, you're right. I think the first thing is that, vaccination has to be taken by our political leaders as a priority for countries. I mean, we have a lot of technical specialists and people who think that it's very important, but this has to be a political decision by governments to make a routine vaccination and to have decisive actions, really to have a big push to catch up on those 12 million children who are under-vaccinated. What we're also suggesting is that a lot of resources have been invested over the last 3 years for COVID vaccination. Why not take some of those resources and reallocate them to boost routine vaccination and really give a big push for child vaccination. So that requires, of course, the willingness of governments, but it also requires the approval from international donors and the international community as well in the cases where this is money given by donors. So it's an important call that we make, really to make that as a top priority and make sure that in the next months we can have a big push and make sure that children are protected against those diseases. We will see an impact immediately as those outbreaks will reduce significantly, and we will have a much better child population with healthier children across Africa.
Yeah, but there are challenges like just now we're seeing in Khartoum, in Sudan, conflict. I'm just using that as one example. There's conflict elsewhere, like in northern Cabo Delgado province of Mozambique. Then you've got climate change impact. I just spoke to a doctor from Stellenbosch Business School about the need for us to change our behavior because climate change has a huge impact. And then you've got vaccine hesitancy. It's going to be a difficult one for governments to manage to trace these nearly 13 million children, because 12.7 million, Louis, you'd agree to me, is closer to 13 million.
You're right. There are areas of conflict in Africa, and that's unfortunate. And we have strategies to address, those situations where we can do campaigns, to vaccinate all children in a group in a very limited time. But fortunately, not all countries are facing conflict at the moment. So there's a lot of work we can do with the majority of our countries in Africa, where we can work on the healthcare systems and really reinvest in the basic healthcare infrastructures. Because it's nice to have nice hospitals in the capital cities, but where we will really make a dent on the number of under-vaccinated children, it's at the community level. So we need to reinvest in terms of resources and in terms of staff, of personnel at the community level, at the lowest level, where we can do that prevention work for vaccination.
Yeah, so it is possible, that's what you believe, but it's a matter of priority and redirecting some of the resources that were used with COVID-19 towards ramping up immunizations. Now, Louis, as we conclude, from a UNICEF perspective, why is it critical that we increase the rate or the level of immunization of our children?
It is a matter of child survival in the end. So it's very important that we have a big push to make sure that all children in Africa are immunized against all diseases and are protected against those diseases. Unfortunately, we still see in Africa a lot of children who die before the age of 5 of preventable causes, some of them being those diseases that we mentioned before. So if we make a push to make sure that all children are vaccinated, we will ensure that those children can survive and thrive later on in their lives.
And your role as UNICEF in assisting governments to do this?
Yes, assisting governments, advising governments, and also building a consensus from the different partners, whether it's the private sector, it's governments at different level, donor governments, really to make sure that that everyone's efforts are channeled towards achieving that goal of vaccinating children.
Thank you very much. Louis Vigneault-Dubois from Unicef Africa Services Unit, emphasizing the importance of finding and vaccinating those nearly 13 million children on our continent who've missed out on one or more very important vaccines or vaccinations over the last 3 years.